Okay, we're back for
We're not back yet.
second segment.
Okay, so this is the second segment of our sort of freewheeling discussion about what we've learned of working with people with schizophrenia, right? And so I think so far we've covered how significant the relationship is, and that you all sometimes have to go in competition with like sort of the psychotic process for some folks to be like an anchor for to be out of that.
Good word.
It's kind of strange to call it like a dream state, but it seems to be for a lot of people a superimposed dream state on top of normal waking consciousness, as if like there's this dream, non-dream, simultaneous confusion of what's figure and what's ground. So we become like figure to the ground, right? You know what I mean? Right. And that lasts. So, and we talked about the families and how our experience of families is not as we were trained, which was that they were toxic and sort of causing it, and that we really needed to embrace them, right? So one other thing I want to say is just how this is one that's always really confusing when you start working with people with schizophrenia. People who they're people with schizophrenia who have more like what are called fixed delusions. So they have this really elaborate false belief system, but they're not necessarily hallucinating that much. It's more of, even though it's more along the line of the delusions than seeing visions and hearing voices. Right. And sometimes those delusions are incredibly normal sounding. And I think we're talking about, like we were sharing how you're meeting a client and you just can't imagine that there's anything. Why would they have this diagnosis of schizophrenia? Because they're telling you about their wife and their children, and in the beginning you may not even know that because you believe them. Why wouldn't you believe them? Yeah, why wouldn't you? And it sounds perfectly clear. And then you get to a question. I mean, this is a real situation. Well, where's your wife now? And you find out that the person says, "Oh well, I married her." Not that there aren't past lives, but they would say that's possible. But I married her in the medieval times. So she's my wife from medieval times, but she's with me all the time now, and I'm fighting this other guy who wants to take her away from me. Right. But you get the whole story that is so logical. Just because people have a diagnosis of schizophrenia doesn't mean that they're telling you necessarily an illogical story. Right. Some people with schizophrenia are very disorganized in their communication, one of the positive symptoms, but some people are telling these very, very coherent, logical stories, or things more modern about the relationship between colors in the environment and frequencies of colors times the number of palm trees they see, and then multiplying that and what that means about sort of complicated mathematical things, but they're extremely logical, but most people would agree there's no evidence to support them. And so you can
logical patterns to things that they see that they're, and if you don't see them, they're going to try and convince you and say, but this is, and to understand that is very real to them, and it's, you can't just, it takes a certain kind of interaction to validate them and be, kind once you understand that this is real, but not to argue the point with them. So if you were in class, it'd be the first advice we'd give people.
You
don't
really
argue with delusion.
You can't really argue somebody out of like what seems to be a false belief, because it's, for whatever reason, it's usually really strongly held. What will happen is a person starts in a recovery path and their life starts filling up with present day relationships, and also they start healthy habits. A lot of times the preoccupation with all that stuff just sort of fades away, and it becomes what's called more encapsulated. It just doesn't impact them so much. So you gotta be patient. You can't just try to like talk somebody out of it, because boy, it just won't work, right?
And the reality of what happens is, as you, like you say, help them have more in their lives, they focus on that. And if a person is on medication, sometimes those delusional beliefs will sort of fade. They may be still there, and they may be still there for a long, long time, but how much they interfere with day-to-day functioning becomes less and less. And you can help them by helping them, engage in what's going on in the real world, and things like getting back to work and learning skills. those become less and less important in their lives. And you never have to go back and re-argue those things. Just let them fade away.
So just to shift it a little so we could just finish this in the second segment, Louise, could you talk a little bit about like this people's belief about the scary nature of people with schizophrenia as being predators?
Right, that's a good point, because I mean, we've known so many people, so many people who have schizophrenia, and by and large have witnessed very little violence ourselves, have not had that as a problem in so much in our clinical practice. But there's such a misconception amongst the public, especially now, every new case in the media of someone who has mental illness doing something, nefarious and committing a crime. The incidence of mentally ill people committing crimes is not nearly what people think in the public. By and large, but what's more than what people realize is how often they are victims of crime. And that is just heartbreaking. Somebody who's barely be able to manage what's going on, walking down the street, imagine what easy prey they are for people who are predatory. They get robbed, they get their stuff taken away, they get sexually assaulted, they're victims of con, and victims of violence, of people who just think it's funny. That we can't. The book says a little bit about the statistics, but the reality is people with a serious mental illness are almost much more often victims of crimes and not dangerous.
Yeah. So let me just give a little quick statistic. Santa Barbara, South County, Santa Barbara area, not counting Santa Maria or North Santa Barbara County, has about 1,000 active adult clients with schizophrenia. About 1,000 active adult clients. And if you go back year after year and you look at the number of folks who had schizophrenia who committed serious crimes, you'll see in a year there are less than probably 5, if that, sometimes one person. So that's 5 out of 1,000. So 995 are more prey than predator, or they're just living in the community. So that's been, the statistics are really shocking to people when you realize how many people actually have schizophrenia. If the highest population for violence is single white 18-year-old, or single, I'm not sure if it's white, but it's single 18-year-old males. So you're much more danger around 18-year-old males than you are around people with schizophrenia in reality. So I think that's like,
and it sort of speaks to how when people are first mentally ill and like their first breaks, which is a hugely important time, it's a very confusing state to them, and it's a very upsetting state to them. And if they go for so long, usually without good treatment, if you can get to people early on in their mental illness and they learn that those are symptoms, the scariness kind of goes away for everybody. So you'll see a lot of people who are dangerous, who are mentally ill, are not treated or don't understand what is going on with them, and so they are acting on what's going on with their illness. With decent, good early treatment, much of that violence would have been prevented.
Yeah, and if also, I think we're going to need to go to a third segment, which is fine here, because I think our buzzer is going to ring soon. But that's okay, because we'll just finish up quickly. But I do think that there also, if you could start working with somebody with what's called a psychotic break early, that oftentimes that person still is very clear that they have goals in life in terms of wanting what most people want, like their own place to live, a job, income, and an intimate relationship. And sometimes if that isn't captured early, don't you think that sometimes people get a little bit institutionalized, even if they're living in a board and care, and they kind of lose their motivation, or they forget what their goals were. So that's another thing we learned. Boy, we really not enjoy that somebody has schizophrenia at 18 years old, but if you could intervene at 18 years old, you have a much better chance.
Right. And even the Maximum book, I was noticing, even some of the terms that they use, there's a lot, a little bit negative, a little bit, dire on, talking about things like people need to be in care homes and even the use of the word chronic in reality is not even hardly used in clinical practice and people who are educated. It's like a negative stereotype that is pretty outdated.
Well, we just want to kind of apologize for that because this textbook is one that I've used for almost 2 decades, but it's a new edition, and they got a new author for the chapter on schizophrenia, and suddenly now we're seeing the word chronic. If you're going to use the word chronic schizophrenia, usually you say people with persistent. I know it means the same, but it's just chronic just became a real negative. Right. So other than that, the book has a lot of good things, but the chapter is not the best. So with that, we are going to end, and we're going to do one more segment here so we could talk just about a couple other sort of pearls that we've learned over the time. So I'm going to turn this off.